In this video, we are going to talk about meningitis. Okay, the definition of meningitis, etiology or causes of meningitis, pathophysiology of meningitis. We also talk about the clinical manifestation like signs and symptoms of this condition and some signs that you can use to discover that this individual have meningitis. We also talk about the complications, uh, diagnostic evaluation. We also talk about the management, which will be based on the nursing management, and also nursing diagnosis and nursing intervention. Please, if you have not subscribed to my YouTube channel, please go and hit the subscription button so that you will be alert anytime I post an amazing videos like this. Okay, now what is meningitis? Meningitis is an inflammation of the brain and the spinal cord that may be caused by either bacteria or what viral infection. Yes, any organism that enters the body can result to what? Meningitis. Okay, now let's go to the cause or etiology of meningitis. Number one, we have bacterial meningitis. And the example of the bacterial meningitis are Neisseria bacteria, Staphylococcus pneumonia, Haemophilus influenza, and the rest of them. Okay, now let's go to viral cause of meningitis. We have herpes simplex virus and also human immunovirus and mumps virus, etc. We also have fungal meningitis as a cause to this condition. Okay, now what is the pathophysiology of this condition? The pathophysiology of meningitis is that the causative organisms enter the bloodstream and cross the brain barrier, and as a result, inflammation of the subarachnoid and pia mater within the meninges will take place. Okay? Yes, that is how this etiology come about. Okay, now what are the clinical manifestation? There will be fever, there will be headache, there will be nuchal rigidity, and also alter mental status like confusion. In generally, there will be neurological deficits. Okay, yes, there will be also issue with sight, which may be photophobia and positive Koenig sign. Yes, let's go to what is Koenig sign. Okay, now this is a Koenig sign. You can see the left one, the one here. Okay, you can see the one here. We call it Koenig sign. Yes, this sign, if you are trying to lift the leg, okay, up, and the knee is not able to straight very well, it is called Koenig sign. If it did not straight very well, it means that the individual is having uh, uh, Koenig sign positive, and is a sign that yes, is meningitis. Okay, and this one that is here like this is called Brzezinski signs. Okay, so in this kind of test, the if the individual, if you are trying to lift the person up, yes, like the way it's lifting, if you are trying to lift the person, you will see that as the person is lifting the legs together, the leg is, you know, is curving. Yes, is curving. That is Brzezinski sign, and is a positive test. When it is positive like this, it is a clear indication that this person is presenting with meningitis what? Infection. What are the complications to this condition? Well, number one complication is hearing loss. The individual might have what? Conduction loss. Yes. And also memory difficulty because it has to do with brain inflammation. There will be also learning disabilities and brain damage. Okay. It will also affect gates. Gates. That is the way you move because the once it's the brain also control what the ear. Okay. And if there is this inflammation, there is tendency that it will affect the ear, and your balancing, how you move, will be what affected. There will be seizure, there will be kidney failure, shock, and the other one. Okay. Yes. What are the diagnostic evaluation that we can use to identify more that this thing is meningitis? What we do first is history taking or history what collection. After history taking of history collection, there is also what we call physical examination. We do uh, some tests like complete blood counts and also blood culture to know if those uh, bacteria or virus we mentioned earlier can be detected. Okay, lumbar puncture can also be done to take the CSF for what evaluation. MRI of the brain and CT scan of the brain is also what conducted to rule out yes that this individual have this condition. Possibly serological test, okay, can also be conducted. Yes. How do we manage this condition? Yes, it's just like if you detect that okay, this is a cause that is due to bacterial infection, you are going to treat with administration of antibiotics that is capable of crossing the blood brain barrier. Okay, we have some drugs like that, like vancomycin, also antiviral medication if it's due to viral cause, and antipyretic because there is definitely going to be what high fever. Now, the nursing management, that this is the area that concerns me. Yes. What is the nursing management? You as a nurse, you do your nursing assessment. Okay. Okay. You do your nursing assessment, you obtain your history of recent infections such as upper or lower respiratory tract infections. You assess also for neurological deficits and assess, in short, sensory neural loss or anything. Meningitis is common. It's the first place that it attack, I think, is the ear. Okay, now the nursing diagnosis. After the whole assessment, you can establish your own nursing diagnosis to take to your nursing care plan for management. Number one can be what? Hyperthermia, okay, related to infectious process. Yes, definitely is going to be because if you check the white blood cell count, it's going to shoot up, and it's a clear indication that yes, there is hyperthermia due to infectious process. Okay, there is ineffective tissue perfusion. Yes, related to what infectious process and cerebral edema is going to be possible. Yes, there is also going to be something like anxiety related to unknown outcome of the condition. There may be risk for injury related to maybe positive culture of the CCF and the rest. Okay, what are your nursing intervention after identifying all these diagnoses? So, the number one nursing intervention is okay, this patient is having hyperthermia. Okay, you have to tackle it by what? Reducing the fever. How will you tackle it? You can take a sponge. If the temperature do not respond, then you can administer antipyretic. Before then, you make your patient to be comfortable and in a relaxed manner. Okay. Can also maintain fluid balance by what? Monitoring of the intake and output and the rest of them. Okay. Yes. Can also assess what? Enhance cerebral perfusion. Okay. Now, if the individual will also come with pain, yes. How do you manage for pain? Yes. In the management of pain, you administer drugs like analgesic, and monitor the response to adverse effects, okay, and the rest. Yes. Okay. Now you assist the patient with positioning of to ensure there is comfort of the neck, because individual with this kind of condition comes with what? Stiffness of the neck. And the patient will try to see that the patient turns slowly and carefully with the head and neck being in alignment, while what? The turning process is what's taking place as a nurse. Evaluate the head to elevate the head of the bed to decrease the what? Intracranial pressure and reduce pain, because individual with meningitis, there is possible, in short, there is high tendency that this person is going to have what? Elevated intracranial pressure, and that is why you are going to what? Elevate the head of the bed. If at this point that we have come to the lecture and come to the end of the lecture and you have not followed my YouTube page, please subscribe. Subscribe to my YouTube page, because you are going to benefit a lot. Thank you for watching.